The paired parotid glands are two of the four major salivary glands that exist in our face. The parotid glands are located in the cheeks just in front of our ears. The parotid gland's main function is to secrete saliva when it is stimulated by the food that we eat. My name is Sameep Kadakia, Director of Premier's Comprehensive Head and Neck Oncology and Reconstructive Surgery program. In this video, I would like to spend a few minutes going over different types of lumps in the parotid gland, how we work them up, and finally, what surgery may look like if it's needed for you. The majority of lumps in the parotid gland, which we may refer to as masses or tumors, are benign. Generally, any abnormal growth in the body can be colloquially referred to as a tumor. Tumor does not necessarily mean cancer, but it can simply mean a growth, benign or malignant, that is simply not supposed to be there. When we first see you for a mass in your parotid gland, we will perform a full examination and check for any other abnormalities in the head and neck region. Following this, we will generally obtain a biopsy as well as imaging studies such as a CAT scan or an MRI or an ultrasound. After reviewing the biopsy results and the imaging studies, we will meet back with you to discuss what we have found. In some situations, depending on what we find, we may recommend close follow-up in a conservative approach. However, the majority of masses in the parotid gland generally require removal both to identify exactly what is going on and to treat it with the surgery. While the biopsies may give us excellent information, they may not be as accurate as examining the mass once it is removed. In the event that parotid surgery is needed, which we call a parotidectomy, we will fully prepare you to understand the risks and benefits, as well as the aftercare and any potential impact to the quality of your life. In the event that a cancer is suspected, we will also have you meet with our medical oncology and radiation oncology colleagues. When parotid surgery is performed, this is done under general anesthesia, and we use an incision that begins in front of the ear and curves around the back of the jawbone, ending in the neck. The incisions generally heal very well as we try to place them in normal skin wrinkles so we can hide them as best as possible. Once the incisions are made, we now begin removing the mass. Some masses are very easy to remove, while others may take more time and diligence. The most critical part of removing masses in the parotid gland is identifying the facial nerve, which is the key nerve that allows us to move that side of our face. The facial nerve runs through the parotid gland and can be thought of as a sandwich, where the outer and inner portions of the gland are like the bread, and the facial nerve runs directly in the middle, like the contents of the sandwich. Once the facial nerve does this, it then goes to the muscles that allow us to close our eyes, puff out our cheeks, and smile. We make every effort to spare the facial nerve during parotid surgery, unless, of course, we are dealing with a very challenging situation, where it simply would not be safe to spare the facial nerve, more commonly in scenarios of cancer surgery. Given the finesse required and the need to find and save the facial nerve weakness is one of the risks of parotidectomy. Although rare, facial nerve weakness can be significant and result in difficulty closing the eye, difficulty smiling, and the possibility of a droop on that side of the mouth. Luckily, most of these nerve weaknesses are temporary, if they happen at all. The most common version of this is a temporary and mild droop of the corner of the mouth, which can happen even if the nerve is perfectly healthy, just as a reaction of the nerve to the surgery. In these scenarios, within a few weeks or a few months, we will begin to see major improvements so long as the nerve itself is healthy and unharmed. In the event the nerve has to be cut or is projected to be entirely weak after surgery, your surgeon will discuss all of these scenarios with you and also offer multiple rehabilitation options should they apply to your specific situation. Other risks of the surgery can include bleeding and infection, like any other surgery, swelling of that area, and occasionally a buildup of saliva, which may need to be drained or opened. Sweating may also occur on that side of the cheek as well. However, this is an exceptionally rare finding. Most patients do very well with parotid surgery and generally have minimal to no lasting consequences. Given the challenging nature of the surgery and the critical understanding of the anatomy, it is very important that you seek care with a specialist who is proficient in this type of surgery. At Premier Health, our head and neck surgery team offers a unique expertise in the comprehensive management of parotid gland abnormalities. Thank you so much for your time, and we look forward to taking care of you.